We're going inside the Medicaid Personal Care Assessment that you're going to need to qualify for Medicaid. This assessment is to evaluate your current day-to-day needs and help plan for the care services you may need going forward. Many people expect this assessment to focus only on basic activities like bathing or dressing. There's more to it. Today, I'll explain exactly which daily activities and support networks your social worker will review with you. You're also going to see how to prepare ahead of time by taking some notes. Let's break down what exactly happens so you know what to expect. When you apply, you're going to receive a phone call to set a time for this assessment. Usually, this call will come several weeks after you submit the application. At the appointment, you'll meet with a social worker. Sometimes a nurse may also consult, especially if you have medical needs that require a more skilled level of care. The assessment usually takes place in your home, where the worker can get a real true sense of your daily routine and the kind of help that you need. However, if you're in the hospital or you're in a skilled nursing or rehab facility, the social worker will meet you there. They're going to ask about your medical history, your current health conditions, and how you manage every day. They're going to look at 5 main activities of daily living, or we call them ADLs. Bathing, dressing, eating, moving around, we call that ambulating or transferring, and then toileting. Beyond these basics, they're also going to ask about instrumental activities of daily living, or IADLs. These include managing your medications, preparing meals, shopping, handling your finances. I have a free care needs assessment worksheet that you can download to help you review what assistance you need. There'll be a link in the show notes. These questions give a full picture of your situation, not what you can do on your own, but what support you already get from your family, friends, or people that you pay to help you now. During the assessment, the worker's going to ask you to talk you through your day, maybe even show you, say, can you show me certain tasks? And if something doesn't line up, like you say, I don't need help with meals, but there's no food prepared in the kitchen, they're going to ask some follow-up questions to clarify. They may also do a quick walk through your home to check and spot any safety hazards, like do you have any loose rugs or maybe poor lighting. They want to help you avoid falls. If your care needs are more complex, a nurse might join the visit or call in to discuss your medications or any skilled care. It's not uncommon for people to already have some informal help, like a neighbor who picks up groceries or a family member driving them to appointments. Before the assessment, it helps to think, who's helping me now and what things are they helping me with? This way, you can give the most accurate picture possible. Once the assessment is complete, the social services worker uses your answers and observations to write a plan of care. This includes a suggested number of care hours per week based on the kind of help you need with ADLs or IADLs. The more clearly you can show your daily challenges, the more accurate your plan of care will be. Having the right information on hand can make the whole process smoother. Getting organized before your Medicaid personal care assessment makes the whole process less stressful and helps you give the most accurate answers. It helps to have a clear record of the help you're already getting from family, who drives you, who brings you meals, who helps you do laundry or maybe cleaning. Jot all of these things down in a simple notebook so you don't forget anything important when you're speaking with the social worker. If you have a medical diagnosis like arthritis, or dementia, ask your doctors to explain in writing how that condition affects your daily life. Instead of a general note, request that your doctor describe exactly how your diagnosis changes your ability to bathe, dress, prepare food, or move around your house. Specific examples like needing help getting in and out of the shower or struggling to open containers in the kitchen are much more helpful than just naming a diagnosis. You don't need a complicated medical letter, just a clear note about how your health makes certain activities harder. When you talk about your daily challenges, focus on the details. If you have days where your symptoms are worse, describe what those days look like. For instance, if you say, I can't do anything on a bad day, maybe you say something more like, on a bad day, I can't lift a gallon of milk or stand long enough to cook a meal. Have a current list of your medications ready, any recent doctor's notes and tasks you need help with. When the social worker asks about activities like the bathing and you need a shower chair, let them know. If you need help with buttons or zippers when you're dressing, tell them that too. The more specific you are, the easier it is for the social worker to see what kind of services or equipment might make your life safer and easier. Always have copies of any notes or lists you want to share so you can keep the originals and the social worker can take the copies with them. Keeping everything together in an organizer means you won't be scrambling to find papers during your appointment. With these steps, you're going to feel confident and prepared to show the social worker exactly what your needs are. The assessment process can feel overwhelming, maybe stressful, maybe scary, but understanding each step makes it more manageable. If this clear walkthrough helped you feel more prepared, subscribe for more straightforward guides on Medicaid eligibility and long-term care planning. I focus on breaking down complicated systems into practical steps you can use for yourself or a loved one. Remember, this care assessment exists to match you with the right level of Medicaid personal care. If you've made it this far, let me know in the comments if you've had a Medicaid assessment and what frustrated you about it. We'll see you in the next video. Have a good one.